你知道那个感覺嗎？
哦，嚟，哇，要扶住下，好痛。
真的很痛。
而家好痛啊！咁係邊度痛啊？係 low back。low back，OK，有冇一路痛落去？冇，但係 low 個。OK。我入嚟。Oh wow, what happened? Come in. Oh my god. Okay.
Yeah, my low back is resting.
Okay. So come on in. Yes. Oh my god, you barely get out of the car.
Yeah. Yeah, this is my father-in-law.
Oh, father-in-law. Hey, hello. Good to see you. Okay, good. Oh, your father's so tall too.
Yeah.
Father-in-law. When you walk, you feel pain already. You barely walk. Okay, good. Okay. Oh, have a seat. 哦，清楚。
謝謝。
坐都有問題，有冇問題？
他沒有。
升高少少。OK。好。OK。哦，哇。OK。我拎。
我就在这里帮一下。
OK。
使唔使翻譯啊？唔需要翻譯啊？
英文 OK 嗎？
可以翻譯一下。
翻譯一下。
哦，翻嚟。
爸爸坐。
爸爸好高喎。
爸爸好高。
我真係，咁。Bowen's father, you play basketball, right?
Yeah.
Oh wow, so tall. So you play basketball too?
Volleyball.
Volleyball?
Yeah, he's a volleyball professional player.
Volleyball professional player? Oh my god, I'll put YouTube then. Okay. So, volleyball, wow. Okay, I see. 咁犀利。OK， 嗱，咁你係發生咩事啊？
就是昨天早上穿裤子的时候，然后我 only stand by one leg。
哦。
然后一提。
卷腹忘记。
呀，然后就痛。
但是之前呢，你
我有腰间盘突出之前。
但是之前没有这样子，就昨天。
之前可能2-3年前 ，like 2 or 3 years ago, it happened before。
也是這樣子嗎？
係啊。
個2-3年前試過一次。
都係咁啊。
但係佢話佢係有 test 過，即係佢有之前有 test 過。
哦。
即係呢個係物管呢個已經。
OK， 等陣先啊。好。喺邊度問題啊？It's all good.
I can't take off this.
再一點點啊。
哦 ，OK， 得咁。哦，你會 wear 個 belt 添啊 ？Oh my goodness！Hip pad，我睇下。From here to here？ 哦 ，OK， 哇，咁快！向後邊唔得啊，好難啊，好痛啊！哦，會啊。
可以。
哦。
這樣痛嗎？這樣痛嗎？
這樣感覺沒有。
如果能這樣玩下去
？No。OK，so 咁向前面 OK 啊？
向前可以。
哦，哇。OK。
也是這裡痛。就向前痛。
哦，對啊。
向後個感覺會冇事，但向前就會痛。
哦 ，OK， 0至10佢最痛幾痛
？10最痛，你看現在的痛。
7、8、9、10。20。
就是如果不碰到那个痛的感觉的话，就是比如说我 sit as this, no any pain。
哦 ，no any pain。
Yeah，但是轻轻一动，如果碰到了，就是可能就很
痛。有冇痛到一路痛落去？
只是 local 這裡痛。
是 local。
就是OK。
一點點，這裡有一點痛。
OK，好。
你知道那個感覺嗎？
哦，嚟，哇，要扶住下，好痛。
真的很痛。
而家好痛啊！咁係邊度痛啊？係 low back。low back，OK， 有冇一路痛落去？冇，但係 low 個。OK。Step to left until touch the wall. Okay, good. Stay here. Make sure. Step back a little bit.
It's too much.
Oh, it's good, it's good. Okay, step to the left until touch. Oh, that's good. Okay, this one is AP open mouth, so you need open mouth. Open mouth, no shake, don't move. It's okay. So, can you do like this, hand and elbow? Yes. Good. Yes, okay. Yes, step to the left. Good. Step forward a little bit. Okay, good. Stay okay. Okay. K house, so step back a little bit. Okay. So, and then step to the left. Okay. K 個嗰邊。OK， 好。
爷爷应该有来看先看一下小心。
OK， 嗱，咁你腰骨唔直啦，for sure 啊，腰骨唔直 OK， 嗱，咁依度你 low back L5 S1，你有冇見到？
就是 L5 S1，就是腰椎最底下那块，和那個盆骨那個
壓迫。
係啦，嗱，依兩個繃中間係 this 位，依個 almost 嚟 touch each other。
而且你沒有彎度，你看到嗎？正常是這樣子，這個
是個 S 嘛。
Like this。
對，但是你的已經很直。
唔單止好直 OK， 嗱，你依兩個骨係咪中間有個 disc 嘅？依兩個骨。
中間那個肩胛不是突出，已經快沒了。
依個冇啦，依個少好多，會唔會啊？你仲咁後生？
你看跟自己的對比。
Oh my god。我，
Okay. 4, 5, 5, 6. 6. Okay. Yeah, one more time, inhale, exhale, or okay, one more time, inhale, exhale. Okay, so turn sideways. Can you turn sideways? This way, sideways. I know it's painful. Is it powerful? Yeah, like this. Don't fall down. Okay, your body will do it, good. Your body, okay. Good. Relax, good. Good, elbow. I'll be super gentle the first time, okay? So let's see if you can take it. Yeah, low back tight. That's tight. Low back tight. This hand. Relax, let this hand go down. Okay, I'll be super soft, okay? This first time I know it's painful, okay? Oh, good. Get some movement. Yeah, a little bit. Yeah, move a little bit. Okay, move up a little bit. Okay. So and move up your hair too, like your hair. Okay, good. Okay, good. Relax, relax. Yeah, just relax, okay? Oh, good. Oh, good, yeah, neck, good. Decompress or spine decompress. Make more space for all this nerve, okay?
Okay.
So, okay, sit all the way back.
See.
Okay, good. Yeah, Yeah. Okay. Good. Okay. Yes, relax. Okay. Your hand do this. Yeah. Under the hair. Okay. I try to carry on my back. Okay. On my back. Okay. Relax. Give me some space. Relax. Okay. Good. Yeah. Yeah. Make sure relax. Okay. Relax. Good. Okay.
Oh my god.
So, yeah, a little bit better.
Better.
So, can you move a while? Tell me.
I can turn. It's okay.
It's okay. So, okay, when you get up, it's painful, right? When you get up, oh, just like.
Let me try.
Let's try slowly. Is it better? A little bit better? Yeah, better.
Better.
Yeah, better. Yeah, first time better. Yeah. Is that not better?
Yeah.
Yeah, better. Yeah, much better. Okay. I put YouTube. Okay, put YouTube.
Yeah.
Better, right? Yeah, better. You feel better. Yeah.
Amazing.
Yeah. So before it's so much pain. Now you stand. Yeah, sit up, get better.
Better.
Yeah, better. Okay.